Another way you can protect yourself from disease is by wearing personal protective equipment, abbreviated as PPE. Your helmet, gowns, gloves, gumboots, and goggles also during work time. Please ensure that you wear them. If you're working in places or in an industry that deals with aerosol, you know that you need to have your mask on. You need to protect yourself as much as possible. Most of these aerosols serve no biological purpose in the human body. So if you inhale them or ingest them, they may cause disease. For those working in a welding company, ensure that you have your goggles on. Protect your nose, because that light that shines as a result of burning metals can destroy your eyes. So ensure that you protect yourself as much as possible by having your goggles and face mask so that you do not inhale the smoke that comes as a result of burning metals. If you are engaging in sports, please ensure that you wear your protective gears to reduce the risk of you sustaining an injury. And also, if you are doing works like plumbing, please ensure that you protect the non-pressure tolerant areas. For example, the elbow. If you don't protect it, you lean on it for too long, may cause olecranobasitis. More so in the hospital, this is the environment where you are likely to get infected because you meet a lot of patients with different type of conditions or diseases. So ensure that you practice hygiene. As I have always said, you wash your hands for at least 20 seconds, recommended by the CDC. Also, you can do double gloving. The other thing to do, ensure that you have your face mask, your surgical cap, gowning. If you are dealing with patients in outpatient department, ensure that you have your lab coat on, or even scrubs. Also, the other important thing is to wear your gumboots. Know how to dispose your PPEs. After using them, if you need to reuse them, please clean them. In the operating room, you are more likely to come in contact with bodily fluids from the patient. So sterility is very important. How do you ensure that you are sterile? Your surgical scrub, proper gowning, proper gloving, wearing your gumboots, wearing your goggles, your surgical cap. After surgical scrubbing, gowning and gloving, ensure that you remain as sterile as possible, even throughout the operation. Anyone assisting in the surgery should be sterile. Anyone who is not sterile should stay away. And if they're in the operating room, they should have their mask on to prevent cross-infection from the people in the operating room to the patient, or the patient to the people in the operating room. When dealing with rays, for example, X-ray, especially those who work in the radiological department or radiography department, ensure that you have your lead jacket on, and also limit the number at which you expose yourself to those rays. The walls of the room should be coated with lead. Also, when engaging in sexual intercourse, please ensure that you use protection so that you reduce your risk of being infected, or chances of you being infected by sexually transmitted disease.